I'm Dr. Vikas Gupta, consultant oncosurgeon or cancer surgeon attached to MGM Hospital, CBD. As we're discussing on gastrointestinal cancers, one of the other important parts of our gastrointestinal tract is what is called as the colon and rectum. As I've already told you initially, colon is a part, or also called as large bowel, is a part of our gastrointestinal tract which starts in the cecum, ascending colon, then the transverse colon, the descending colon, and the sigmoid colon, and then it enters into a rectum. So many of our patients who develop colorectal cancers, again, the number of patients being affected by this is gradually increasing every day. There are certain factors which predispose the patient to develop colorectal cancers, such as a sedentary lifestyle is a very important cause. Patients who consume a lot of red meat is an important cause of colorectal cancer. Besides that, consumption of alcohol and smoking also contributes to it. The other important cause is genetic. Obviously, many patients are predisposed to it genetically, and they have to be followed up very nicely to be sure when they develop cancer and to treat it very early in their period of development of cancer. So there are various signs and symptoms of colorectal cancer. The most common is some kind of bowel changes, like there will be constipation, diarrhea, sometimes constipation. So any alteration of bowel habits needs to be evaluated, especially so in the elderly age group, wherein these cancers are much more common. Besides that, any kind of bleeding which is happening per rectum or during defecation has to be evaluated, because it is also an important indicator that there might be something wrong inside. Sometimes it may be just an hemorrhoid or piles which is causing the bleed, but sometimes it can also be cancer. So you have to show it to a doctor, get it evaluated, and then only proceed with the treatment. So this is about the signs and symptoms of colorectal cancer. When it is localized, it is the symptoms. When it is in advanced stage, patients may develop vomiting, they have distension of abdomen, there is obstruction, so patients may not be able to pass stool or pass motion properly. So this is again a sign of an advanced stage of cancer and has to be evaluated by the doctor. So this is brief about signs and symptoms of colorectal cancer. Whenever the patient has any of the symptoms, we need to evaluate it. The most common and the very accurate method of evaluation is what is called as colonoscopy. In colonoscopy, we pass a tube which has a camera inside through the anus and go into the colon and the rectum. We see for any lesions which are there or suspicious lesions in the rectum and colon, and we take a biopsy from it. Once the biopsy is confirmatory of cancer, we are sure about it, and then we proceed with the staging of the cancer. For staging, the most common test is the CT scan of the abdomen and pelvis. We see for any lesion, see any extent of growth, any spread to the surrounding structures, or any fluid inside. So this gives us an idea about the stage of cancer. For patients who have cancers of the colon, the treatment and the main treatment is surgery and only surgery. So patients need to undergo surgery in which we remove part of the colon or the entire colon, and then we join the colon, the two tubes together, so that patient can, the intestinal tract can function properly and the food goes ahead. Sometimes we may have to do a temporary, what is called a stoma, for diverting the stool contents outside so that the joint heals properly, and then we reverse it again so that the continuity is maintained and patient passes the stool normally from below. In many patients, we will have to give some kind of therapy before surgery, more so for tumors of the rectum, in which we give sometimes radiation and chemotherapy before surgery. We treat the patient with chemo and radiation followed by surgery, and sometimes with chemotherapy again afterwards. So this is the overall treatment of colorectal cancers. So patient should be aware about the signs and symptoms, what needs to be evaluated, to approach a doctor at a timely period and diagnose it as early as possible. Again, in MGM Hospital, we have a very good department with facilities of endoscopy, and if diagnosed with cancer, surgical treatment options are also available. So any patients with this kind of symptoms, do consult and get it evaluated timely so that you are curable in a very early stage of